So Kacie, it's kind of you reached out to me and wanting to tell your story. Was it Shauna who you know?
Yeah, I know Shauna and Gemma.
All right, okay. So
So
so what's your do you what's your background? What do you go to the gym? Like what's
Shauna's my coach. Yeah, yeah.
okay?
So she got me into lifting and strongman and stuff when I
Hmm.
had never set foot in a gym before.
Oh, really? So
um,
how long have you been doing it for?
about 18 months.
Really?
Yeah,
Right.
something like that.
Yeah,
Yeah, give or take, a bit
yeah.
more than that maybe.
So it's
Um,
fairly it's a new thing to
yeah, yeah,
yourself,
yeah,
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 yeah.
yeah. It's I say when I had my leg, I couldn't have considered going to a gym.
Really?
So it was quite a big thing for me.
Yeah.
And it was my physio that was I was seeing from a rehab when I started on the prosthetic leg.
Hmm.
And my sister bullied me into
Okay.
like go and find a gym. I said, "Oh, I'm not
Yeah.
really a gym person, but it's become a huge part of my life, and it's made a big difference."
So why is that? Because I go all over the place. I usually start like where you're from and all that kind of stuff, and then lead up to the
Hmm.
issue or to the story, or what you want to talk about. But I'm intrigued to kind of know because that sounds like it's fairly recent that you kind of found something new, which you
Yeah,
were very reluctant to join
yeah,
before. Bit of a probably a life change, really. You know,
it
it's
was.
probably
Yeah,
something you've gone through heavily, but
yeah.
it's how did you get what's the reasons why, you know?
Um, I think I just felt it happened across the right gym. I think the big commercial gyms and stuff would have terrified me. Like I say, I'd never been in a gym before, um, and it's just the community there. I think, and the support and the encouragement, and it doesn't matter that I've got one. Like nobody really, you know, gives a shit. Can I swear?
You swear, right? Of course you can, yeah.
Yeah,
Yeah.
it's just
Hmm.
yeah. Jonah just goes, well, you know, you can do it. Just do it.
Yeah.
um,
It's kind of it's bizarre, isn't it? Sort of, you know, was it something you were looking for? You were looking for a new pursuit? Was it something you were looking for a new purpose
not
or something like that?
not
Or
really. I think having lost my leg, I basically wanted to future proof my body, and kind of wrap myself in as much muscle as I can to make sure that I can get off the toilet in 30 years.
Mhm.
Like that's kind of what it boiled down to. And I think I say when I was going through my rehab, with the physio, I wanted to continue that because I was
Mhm.
doing pretty well, and I thought actually maybe there's something here, and I can do physical stuff whereas I couldn't before.
Right.
Um, and yeah, I think it was just that sort of I need to be careful here because otherwise I'm going to be in a wheelchair by the time I'm 50.
Right.
And
Okay.
that's not a life I want for myself.
Right. Okay.
So yeah, it was a kind of a mindset change, I guess. Like, and when I figured that I could do it,
Mhm.
I was like, oh, actually, this is quite enjoyable,
Mhm.
which I surprised myself
Yeah.
at.
Yeah. Well, let's rewind this a little bit. I mean, originally, where you from, and how do you come in the northeast? Because that's not a northeast accent I'm
It's
hearing.
not a northeast accent, no. So I grew up just outside Glasgow,
Mm.
and then I was in St Andrews on the east coast for uni. I come down here for a job in 2014. So I've got a Teesside twang. um, but yeah, so I was here for boarding school actually when I was 16. I was just
Okay.
outside York for a
Hmm.
couple of years. Went back up to Scotland, went to uni twice. And then yeah, it was the job that brought me down here.
Yeah. And what's the job? What
Um,
is the job still the same that you take
yeah,
on?
yeah, yeah. Ironically, I'm a prosthetist, so I fit false limbs, which I did.
Really?
Yeah, I did before I lost my leg, and then became a patient. So,
I mean, have you ever met anybody else who has had that path as well or not?
not that way around. There's a few prosthetists that were amputees,
Hmm.
and obviously they know from being an amputee, and then they've gone into the line of work that way. But I
Yeah.
don't. It's quite a small profession. I don't think there's anybody else that has done it
Hmm.
that way around.
So what
Um,
intrigued you to kind of go into that? Was it always something you wanted to do, or did you kind of, you know, some obviously you find your path and you find your way by doing one thing and it leads to the other, and go,
yeah.
ah, this is interesting. Do you know what I mean?
Yeah.
Was it one of those?
Well, I did, yeah, kind of. So I started off doing astrophysics at St Andrews, which was quite hard, funnily enough. And then I got rid of that. I'd then changed to human biology, which I enjoyed physics and biology at school, and I guess
Mhm.
this is kind of an amalgamation of the two. Um, Graduated from that one into the first recession in 2008, 2009.
Mhm.
So there was no jobs. So I was like, what am I going to do here? So I took a year out and then come across this course. So
Mhm.
it's a specific course you have to do to qualify to treat people. So went back to uni for a second degree. So
Mhm.
it was a convoluted path,
Yeah.
but it got me where I wanted to be in the end. So,
Yeah. It was a.
um,
I mean, what was the intrigue in prosthetics?
I did my first dissertation in neural prosthetics. So where they have implants in the nerves and you can control it. It was a bit out there and it's not quite come to fruition yet.
Mhm.
But so there was an implant in the actual nerves and they can control the hands from it.
I've always wondered that because I've followed a few people. I think there's a little girl Tilly. I think years ago. I
Mm.
don't know. I forget the company, but they do the bionic arms.
Yeah, yeah. So they,
Um,
they do. It's similar. What I say, what I was looking at in that dissertation was more research
mhm.
based. It's like the implants you can get in the brains as
Mhm.
well. Now they have um, oh god, what's the word? Electrodes that fire off your muscles.
Mhm.
So they don't go in the body. They're just in the socket and then the muscle firing.
Mhm.
That's how the fancy hands that you'll see, like the
Yeah.
multi-articulated ones, that's how
Mhm.
they're controlled. So I think that's kind of what sparked my interest. Most people go, "Oh, it was the Paralympics," but for me, it was more the kind of academic side of it, I think.
Yeah.
Um, and then obviously as I started working, so actually it's the people and
Yeah.
the treating because we don't get to deal with it. I work with the NHS, we don't get to deal with the Paralympians and the fun prosthetics very much.
Yeah.
It's very much my bread and butter is your 60, 70-year-old
Mhm.
dysvascular diabetic sort of patient who wants to walk down the corner shop, or
Mhm.
one of my patients, he just wanted to stand up and have a wee. And
Right.
but actually that's really satisfying that you can let somebody have that little bit more independence.
Yeah.
That it just gives them that, I say, a little bit of better life, I guess.
Well, it's kind of it is. It's quality of life, isn't
Yeah,
it?
yeah,
And I've done a lot of stuff with shout out to everybody who I've interviewed and worked with, who are have life now in a wheelchair, who were able-bodied and now in a wheelchair. So it's kind of like it's understanding. Well, that was my normal functionality every day, and you just took it for granted, and now I'm not. And then
you have to
there's a
work
big
around it.
shift in that as
Yeah,
well. And your approach will probably be different because you've done the research and you're working with people trying to help people, and it's super fascinating. It's really interesting,
yeah.
and I still want to go down like how these things work already. I can't get my head around it, um but being in that position yourself, I don't know, I can't get my head around that. Do you think about that as well, Casey? Because I'm
So now that I'm living it, kind of thing, is
yeah
is different. Yeah.
yeah.
I think as a clinician, you always wanted, obviously, I always still do, the best for your patients, and you want as much you do as good as you can for them, and that's different for everybody. As I say, some people want to go and run half a marathon or whatever. Some
Mhm.
people want to walk to the corner shop, and that's absolutely fine. Um, but now living it, it's given me a very different perspective because I get really frustrated because obviously the NHS is struggling for funding. That's not a not a news story,
Mhm.
and I'm taking things because we have to take it to the team meeting if you want to change anybody's prescription. And if I've got a young patient and I want, right, he needs a better foot, and that
Mhm.
foot might be £3,000 or £4,000, and they're going, oh well, we can't. And I get really annoyed about it now because I mean, this leg is it's not my first leg. It's changed my life, and the best way I can think of describing it is it's telling somebody to go and cut the grass with a pair of scissors.
Mhm.
Like you can do it, but it's a pain in the arse. And giving that person a better foot or a different socket or whatever, that changes every little thing they do in their
Mhm.
day. And I say this leg's completely changed my life, and it's made it 1,000 times easier. It's still hard, don't get me wrong, but and I say having that perspective when nobody else in my team would,
Mhm.
I get a little bit pissed off about it, and I kind of want to go to the higher ups and the finance team and go, well, I tell you what, you try
Mhm.
living like this, and then tell me that that patient isn't worth that 3 grand foot or whatever it is.
Yeah.
Um,
It's interesting because I think there should be sort of experiential days
yeah.
where, you know, I've seen it before. You go wheelchair rugby, sit in the chair, and you try and play this game. Oh, this is
Oh, it's
hard.
hard. Yeah,
It's a
yeah,
really different kind of rhythm
yeah.
to functionality and movement, and you're restricted
100%.
as well with what
Yeah,
happens if you haven't got core strength. And there's so many different levels of
yeah.
this.
I mean, I was back in my wheelchair last week because I had an infection,
Mm.
and I mean, I use my wheelchair every day anyway in the house mostly because it's just easier. But this, I was having to do my job, get in and out of the car, and all the rest of it from the wheelchair, which I did for months before I had my leg. But I was like, Jesus, this is hard.
Mhm.
And my whole body's still hurting from it. And it's like it's difficult. And
Yeah,
people, unless you're doing it, you can't appreciate it. I don't think you can empathize with it, I think,
yeah,
to a degree. But when you're in that position yourself, you just think this is a very different
mhm,
story. Um,
yeah.
and I say, yeah, it is frustrating from some points of view, but equally, it gives me I think, a better relationship with my patients
Yeah. I
because
don't see why I
yeah,
couldn't though,
yeah,
really.
well, yeah,
I kind of, you know, because it's lived experience.
yeah,
And I always, you know, I've talked about this and I've mentioned this for my personal opinion, lived experience. I think, I don't know, could you validate that more than someone who's an expert? I don't know. I've
I
been told no, I've been pushed back on
don't
that.
think so.
I think it's a
Yeah,
little bit of both. I think it has to be
yeah.
both.
I say, obviously, I was treating patients for a long time before becoming one. And yes, I say it when you're seeing them every day, and we spend a lot of time with our patients, so it's not like a GP or whatever that you go in for 10 minutes and then
Mhm,
we see them sometimes weekly, sometimes depending what they're going through. So we do know
mhm,
what's going on. Like I'll know if they're getting divorced or there's something going on or whatever. We have
mhm,
that relationship with them. So I
mhm.
think you can understand a little bit because of that relationship. But I say when you're actually living it, it is different. Um,
Yeah, because everyone is different, like you said. I mean, there's people who are active and people who are less active and don't
yeah,
really want much, but they just want to get up, like you said, and go and make a cup of tea and sit back down. That's it. That's all they need.
yeah,
So can I have something that works for that? Whereas somebody else who wants to run a marathon and is very active and is kind of, this isn't good enough, and I need something else, but I can't afford to do this. So it's
yeah,
like, you know, you can bang on all day about lack of funding and all this kind of stuff, but there is money out there, and I don't know why it's not going into the right places.
yeah. And my argument as well is so. For example, I had a patient the other day. I think he's 33, and I wanted to get him a better foot. So he's got 40, 50, 60 years of being an amputee. That has a lot of an effect on the rest of your body. Giving him a better foot now is likely to prevent him, knee replacements, hip replacements, back problems, all the rest of it. But that they don't look at it like that. That's not our budget, so it doesn't matter.
Mhm.
And I say it's a bit, it is frustrating. But the little people can't do anything about
But
it.
and then now we go into the kind of the knock-on effects of having,
Yeah,
you know, you're not just looking at the leg which isn't there anymore or the limb
that's
which
the
isn't there
rest of your
anymore.
body. Yeah,
It's everything else which you're overcompensating for,
yeah.
and then you're kind of leaning a bit too much to the right or whatever it is, and then you've got a bit of a stoop, and then there's a hunch, and then
Hmm.
the back goes because the knee's kind of overworked, and then it just
Oh, it is. It's everything gets harder worked.
it,
Um,
it is, and it's looking at the full body and the functionality of it. And if the prosthetic is better, then the functionality of the whole body is better, surely.
Yeah, I would say so, and it becomes less energy consuming as well. So I mean, I'm fairly active, um, and I can manage reasonable amounts, but it's really hard work. So as an above knee, you use an awful lot more energy. Your oxygen consumption is way higher, and putting something different under your socket makes that easier,
Mhm.
kind of thing. So yeah, it does, yeah, takes a bit of strain off. I mean, my back's shot already, like it was from before.
Right.
I get chiropractors and physios and all sorts just to keep me going.
Yeah.
Um,
Management.
yeah. So and that's just, I say, my sort of my yeah,
Yeah.
doing the best I can for my body and
Yeah.
keeping it in as good a shape as possible, which
Yeah.
is, yeah, going back to why I went to the gym in the first place, kind of thing.
can you explain a little bit of the issues which probably nobody thinks about of the prosthetic? Because I've met people and it's the rubbing on the limb which is there where the prosthetic's going
Mhm.
onto. So it's maybe the sock that goes over the top of the limb that goes on top of, and how it is attached and how it supports and straps. There's so many different things than just
Oh,
the
yeah.
actual,
Then just the like, yeah,
the
you see
leg
it and you
itself.
think, "Oh, yeah,
Yeah,
that's quite
yeah.
smart."
Go, oh, that's it.
Yeah.
Yeah, but it's not
It's
that.
no
It's
it's
where
attached
it's
to a
how you're
human.
wearing it, and it's the
Yeah.
attachment to the body.
Yeah.
You know. So what's the best solution? Well,
Um, I
and
mean,
what issues have you got? Sorry, I've kind of
no, no,
I've
it's
skipped
alright.
past me one question there.
I've
Sorry.
actually been pretty lucky, touch wood, with my stump. I say I had an infection last week, and that's the first time I've had any problems with it. Really, I've had a few rubs and bruises, and it aches a bit.
Mm.
But the socket itself's actually, I haven't had too many issues. It's relatively comfortable for what it is. Like, it has to be tight, and it's an intimate fit because it's an above knee, so it goes up where you don't want it. Nobody wants it, but
Oh, so does it go wrap
um,
around your waist? Does it got to be
this one
attached?
doesn't. My old one did. So yeah, some of them have a belt, which they're not very comfortable, and when it's hot,
Yeah.
it's sweaty.
Yeah.
This one's just so it's suction, so it's just the socket. I don't have any belts on this one, so
Mhm.
it is better. But again, sweaty.
Mhm.
But yeah, every patient is different from what is best suited for them and what they can tolerate as well.
Mhm.
It varies hugely as to how the amputation was done, the reason, what
Yeah.
how the patient manages with pain, discomfort, whatever you want to call it, because it's not a natural way of loading the body. So it is to some degree always going to be uncomfortable.
Mhm.
There's not really any getting away from that, and some people can't quite get their head around that. I'm a bit bullheaded and kind of just tend to carry on for
Mhm.
as much as I can.
Yeah.
But yeah, say some people struggle with that, which is understandable because I say it's not a comfortable thing. It's
Mhm.
not a natural thing to be doing, but it is what it is.
Mhm. So how did you get your infection? Was it just a everyday thing?
The last one, I just had a stupid little cut. Um,
Right.
and obviously it's a sweaty environment, so it's a breeding ground for bacteria, and obviously that tiny little cut was enough. I think it had been brewing for a while, to be fair, because I've had a few, it had been sore. And then, yeah, last week it went a bit mad, and I couldn't wear my leg, it was agony. So,
Right. Yeah.
so yeah, it's just one of these things, and that happens, blisters, infections, rubs, all these things, and then you can't wear the leg, and then you still have to be able to function in your wheelchair.
Yeah.
Which that's what I always say to my going for PIP or whatever. Tell them your worst day because you have to still be functional.
Yeah.
And it's hard, but and things like PIP, that's another story.
Mhm.
Again, that's usually frustrating. According to them, I can walk unaided. It's,
Right.
which it just boggles my brain. I'm like, right, take that off me and watch me walk. Like, what is that if it's not an aid?
Yeah.
But yeah, because I don't use a stick particularly, um, unless I'm walking a bit longer, then
Yeah.
oh yeah, you can walk unaided. All right, okay.
So why do they come to that conclusion when you work in the field? You're
Oh,
clearly an expert, and
I
also you're an amputee as well.
I've no idea. That's their criteria or whatever you want to call it. Um, and I
So
get there's people that take the mick out of it, and there's people that abuse it, but those people still abuse it, and then actually the people that genuinely need it and are entitled to it
mhm,
don't want to apply for it because it's demeaning,
mhm,
to be honest, and being made to go through everything in your life that you can't do
mhm.
is it feels horrible. I mean, I'm on the lower rate, which everybody's like, "What?" Like, yeah, but I could argue it, but I don't have the energy. I just, it's not. I mean, so I spend probably 200 quid a month on physio and chiropractors, and to keep me in. So it's expensive being disabled. I had to get all my house adapted. I had to pay for all that myself.
Really?
Yeah, because it was all
Wow.
means tested. So my ramp, all my doors I had to get changed, my wet room, everything. But I still feel guilty that I applied for PIP and I get it
Yeah.
because I can go and lift weights in the gym. And in my head, I'm like, well, but you maybe that's you shouldn't be having it. And I think, well, if a patient said actually, you tell them not to be stupid. So I take it and that's fine. But it plays your mind a little bit.
It should, but it should be encouraged to go to the gym.
Exactly. Oh,
Because you
100%.
strengthen your body and you're going to function
Yeah,
a little bit better.
yeah. So
So
we're
would you not deserve it more because you're actually putting more effort in?
I'm trying exactly. I'm trying to keep my body going as long as I can.
Yeah.
But if we do that, we're not disabled enough.
Right.
And if we don't, then we're not trying hard enough.
Yeah, you don't tick the boxes.
Yeah.
Yeah.
And it's
Why is it such a broken system when clearly it's common sense and clearly all you have to do is ask the people who suffer?
yeah, it is a broken system. And as I say, the people that take the piss still take the piss. And so I applied for it before I lost my leg because I could walk less far then than I can now. And I'd suffered for, I don't know, 5, 6, 7 years, something like that. I went for my assessment and she said, why haven't you applied before now? And I said, because of this. This is exhausting and it's stressful and I didn't want to do it. But then I think, well, I go to work and I pay my taxes and actually this life is quite difficult. So if I can have a little bit of help, then you know what, I'll take it. Yeah. But no, I'd say it messes with your mind. And I think you're made to feel like you don't deserve it and guilty for it. When actually, and I keep having to say to myself, right, what would you say to a patient if they came in and said that to you? You'd say, no, don't be stupid, I'll write you a letter. And so it's that kind of, right, just accept the help.
Yeah, I think it's important I wish we could show everybody and I wish we could show them exactly the whole functionality of everyday life.
Well, this is it.
And then they might have a different
come and live a day in my life. Yeah,
on it. It's
exactly.
like a day in the life. But even if we could just see that and go, right, well, I thought because she's got a prosthetic leg, then she doesn't need the ramp and all the things, you know what I mean?
Yeah.
Oh, but I do need a wheelchair. Why? Because that's backup just in case I have an infection. But what level of wheelchair have I got? Have I got one that can just get us down the ramp? Or can I get up the curb or not the curb? Because that's a different story in itself.
It is, 100%.
Yeah.
And I'm quite lucky with wheelchairs. I had quite an active one before I lost my leg because I was using it basically all the time. So I've got a nice lightweight fixed frame one that stays in the car. But that doesn't fit in my house, so I got it's a heavier one, so but it stays in the house and that's fine. So for longer distance and stuff, that wheelchair is better, and I'm pretty agile in it. To be fair, I can throw myself about a bit. But but it's hard work,
Well, and you got a cost of 2 chairs now, and you've got the kind of maintenance of 2 chairs, and what happens if you have an issue with a wheel or something like that?
Well, that's it. And to be fair, the NHS has sorted me out with them. To be fair, like I can't complain on that side of things at all. They've seen me right, but equally, if I hadn't had that chair first, I wouldn't have to. It's just that it's a custom chair. They can't take it back. It's mine, so that's fine. But it's not suitable for my house, so that's why I got another one when I needed it in the house. But
you don't think about this, so? Because honestly, I don't think anyone would just blow their mind. You go, actually, I'm not even thinking about that.
No
one thinks about anything until you live in it.
No, well, this is it, yeah. And even we're all guilty of it. Before I ended up using my wheelchair a lot, took everything for granted.
Yeah.
And then you end up, I say, using it, and you think this country is not accessible. And like my sister says the same. Like she's become very aware of accessibility and could Kacie manage this? Whereas before, again, she's able-bodied. She wouldn't necessarily even consider if there's like a little step up to go in a shop or a cafe or whatever.
Yeah.
As now, she'd be like, well, you can't go in there.
I've mentioned this before on an interview, but I think about parking too high up on a curb on a path.
Yeah, and you can't get past with a wheelchair or a buggy or whatever.
Even with buggies as well, because if you've pushed a buggy uphill, it's a bit of a tall order. Like so, and going round onto the road with kids and stuff like that, that's a stressful environment as well. Yeah. So I can't imagine when you kind of go, well, I can't get off the curb. I have to go back down to the ramp, and then you're just adding on to the distance of what you're already going through at the same time. And
people do it all the time. It's just it's thoughtlessness, I guess, and it's not actually realising that is causing a problem for somebody.
Parking spaces, getting out of the car, because I've seen, just a normal functioning car, the door swings over, you got to pull your chair through from the back, and then you got to put it down, then you got to put the wheel on, then you got. Do you know
Yep.
what I mean? I've seen it.
Oh yeah,
I've
I was
seen it
doing
all.
that last week.
Yeah,
I was crushing upside down, me, because I haven't had to do that for a long time
yeah,
because I've not used the wheelchair outside really.
yeah.
But going back, but yeah, like
Mm.
you say, you have to still be able to do it.
Yeah, it's
Um,
heavy work on the shoulders as well, so it's
yeah,
overuse.
and
And
honestly, I'm still
yeah,
paying for it now.
yeah, yeah.
Um,
Well, let's go back to clearly you've had health issues, and I'm intrigued to know what led you to be in a wheelchair. You've talked about other things like your back and other health issues, and then it's probably a choice, I'm guessing, with the leg.
it was, yeah,
Right.
it
Okay.
was.
So can we start with like what were the issues, and then what
So
are the issues?
I'm hypermobile, which leads to various problems, but means you're more likely to damage things. So it was just a stupid injury on my knee. I was kneeling on the floor and I stood up, tore the cartilage. Um, Little surgery, that was fine. Then, well, I don't know, 5, 6 years later, I damaged the articular cartilage, had another surgery. Just keyholes. That was fine again. That was all right.
What were you thinking at this stage? Oh, it's just a
Oh,
daft
it was
thing.
just a little
Yeah.
surgery, yeah, you know, it
Yeah.
wasn't particularly, didn't really think much of it. You sign your bit of paper and you take the chances and that's fine. And then I think it was 2011, I had another keyhole because the new cartilage that was growing kept overshooting. Um, so they had to go in and clean it up basically.
Mhm.
So I think it was that surgery that caused the CRPS, which is complex regional pain syndrome. And I remember vaguely this being different from the previous surgeries. Like I couldn't tolerate the shower on my leg.
Mhm.
It was bright purple. It was really painful.
Okay.
Nobody picked up on it. They just kept giving me stronger painkillers. And I think it was 2016 because I had continuing problems with my knee. I had arthritis, and it was just, I say, continuing after the first surgery. Um, and I went to a surgeon not long after I moved down here, and he kind of went, "That looks like CRPS. Do you know what that is?" And I went, "I've got patients that had it." So yeah, yeah, I do. Um, He's like, "Go and have a read up on it." I was like, "Right, okay." So then I say that was 5 years after the original symptoms had started. Um, had various treatments. I've got a spinal cord stimulator, which is like a TENS machine but in your spine. So it kind of disrupts the pain signals. So basically the CRPS messes with your nerves, and you just get pain signals all the time. So like a cool breeze, air conditioning, anything like that, I couldn't tolerate it. My trousers hurt, my socks hurt. Wearing a shoe was really difficult. And I say they just kept pounding me off, giving me more painkillers. Eventually went across to Liverpool for, they specialise in it, so I got some treatment there. So that's the spinal cord stimulator, pain management programs, all the rest of it. And then 2022, I think it was. So this is just getting a bit silly. I can't keep up. It was just getting worse and worse, and the functionality was getting worse as well, which was actually almost more problematic because it was kind of like dragging a dead weight. And by this point, I was using my wheelchair most of the time, like even in work. So it's 10, 15 meters to the lift in the wheelchair, up and then back into the fitting rooms. And excuse me, saw a surgeon at James Cook, who'd sent patients our way, so I knew that he had dealt with it. And I said to him, "Look, is amputation an option?" And he kind of went, "Yeah, probably." I nearly fell out my chair. It's like, because I'd asked 2011, 2012, I think I'd gone to the surgeon and he'd gone, "Oh, what do you want me to do?" I said, "Cut it off." He went, "You can't do that." It's my leg. So say when I spoke to this guy, and he was like, "Yeah, we can look into it." And I kind of said to him at the time, "Look, in your opinion, without a crystal ball, is it going to have to come off at some point anyway?" And he went, "Probably, because the trajectory it was on, it was just getting worse." So after that first chat, he went, "Right, go away, try." There was a few treatments left to try. So try them, come back and speak to me. So I did I did everything. I tried physio, hydrotherapy, I tried acupuncture. Um, there was medication that Liverpool gave me that was immunosuppressants. It was bloody horrible. So that was about a year. I threw everything at it, and it continued to get worse. So I went back to see him, and I was like, right, we're done, I think. So yeah, November 23, um, had the amputation, and it was it was terrifying, but it was also a relief. I remember waking up from the surgery, and because obviously I've seen patients every day with limb loss, but my brain, I was a bit mangled. My brain wouldn't compute that it was my body. So I was looking down, and obviously the leg was gone, but it was just like, well, it's not. It was a very odd feeling. But yeah, to say it was mostly relief. Um, but I knew the possible risks. So I've seen patients that get up and do really well with this condition. I've seen patients who can't wear a leg because it goes up into your stump, and then you're knackered basically. Because I couldn't tolerate touching it, couldn't tolerate anything anywhere near it. So yeah, there was a risk there, and it's kind of a toss the coin and hope for the best, and you don't know till it's done, and you kind of put it back on. So um, I had a lot of uh, psychological help. I was lucky that the company I work for have a psychologist that specialises in pre-amputation patients. So I spent a lot of time with her, and actually came to the conclusion that, because she said to me, right, if you're going to be stuck in a wheelchair either way, which is where I was going, would you rather with or without your leg? And I said without really even thinking about it, because at least if it's not there, people can't bang into it. There's no, I can sit in a room with the window open, or air conditioning on or whatever. So even if I didn't have the leg, I couldn't wear a leg. If I was in the chair, it would probably be all right. So I think by the time I went for the amputation, I was mentally prepared enough for whichever the outcome was. And I knew enough to try and do the things that I could to prevent it going that way. So yeah, it was a journey.
Yeah, I mean, it sounds like it's a long, arduous journey, and there's a lot
Yeah,
of difficult decisions along the way as well.
yeah. Um,
Um, the condition, is it just come out the blue, or is it a genetic kind of condition?
they don't really know what caused it, so it's like it's usually caused by a surgery or an injury. Um, it's like a 1 in 5,000. As I say, when you sign your risk, you form before the surgery.
Did you know about this beforehand, before you signed up?
No. So I think it's much. So when I had it, even then, so that was what, 15 years ago. Most clinicians didn't believe that it was a thing. It was psychological. It was in your head, and it wasn't as well known as it is now. And I think there wasn't enough knowledge from anybody's point of view really then as what there is now. And it's still an unknown really, as to who gets it, why they get it, who's got a increased risk or whatever. It's completely random, and
Is it?
um,
It's
it's
awful not knowing any kind of information, isn't it?
yeah, and
Because
I say
you like, even if you've gone through it, you still like to validate this is because X, Y, Z, So, if you're susceptible to maybe arthritis, and then that's the reason why, and then that connects to the thing
yeah.
because there's a marker in your DNA, and do you know what I mean? So you'd like to think there was a map, a little bit
Well,
of
yeah. I
a
mean, there
route.
might be. They just haven't found it yet. And I
Yeah.
think any nerve condition we don't understand because you can't see in the nerves. I think is like it's like phantom pain and stuff. We don't understand it,
Mhm.
and I don't know if we ever will. I think there's loads of research now around the CRPS and all the rest of it, and treatments and various things like that. They are dead against amputation, um,
Really.
and I think I struggle with that a bit because they left me with no so after I tried the last drug that they gave me, um, I had a review with the doctor over there, and he went, "We'll give it another 4 weeks." Is that right? Okay. And if it doesn't help, I could still just come off it. Right? Okay. And I said, "What else can we try?" And he went, "Oh, that's about it. There's nothing else really. And that was just the end of the conversation. I was like, well, you're not living this life.
Mhm.
And I say that he's brilliant. Don't get me wrong, but he's very academic, and he wrote the NICE guidelines. Essentially, chaired the committee that did. And the NICE guidelines say don't amputate.
Mhm.
Which I say I do struggle with. I don't think I'd still be here
Really?
if I'd been left with the leg, because I couldn't continue that life. It was all consuming. I mean, to look from the outside, I was still working full time. I was still going to the horses. You know, if anybody looked, well, surely you're doing all right, but it wasn't,
Yeah.
because that was all I could manage. Then I would go home and I'd be wrecked.
Yeah.
I couldn't cook. I couldn't clean my house. I couldn't do anything because I was just done. The pain was, I say, it was all consuming. And it's called the suicide disease,
Mhm.
and that's why. Um,
Has it got a high risk of suicide from it?
because I say because there's
Yeah.
very little effective treatment methods,
Yeah.
um, and the pain is so bad. I mean, so there's something called the McGill Pain Index, which has got things like amputation of a digit, childbirth with no medication, whatever else, cancer, etc., and CRPS at the top.
Yeah.
Um,
Is that
so
because it's like an unknown because you can't really like
y-
track it or mark it?
I think, yeah, and I say I think nerve pain is something that, uh, yeah, and I've got a couple of friends who I met through the program at Liverpool. One of them has 2 children, and she said I'd rather give birth 10 times over again than be keeping on with this.
Mm.
Um, so yeah, it's and because pain is subjective as well, so
It
everybody
is.
experiences it differently.
It's tolerance levels as well.
Yeah,
Obviously, you just wanted to kind of keep that functionality of normal life. So you're horse riding, you're doing all the things you're trying to do, but there's a knock-on effect of that. I'm going to suffer later on because of inflammation, and that's pretty much
yeah,
where it is, isn't it?
yeah.
So, but no one can see nerve pain. You can't see you going through anything.
No.
You could be sitting here right now on an 8, and we'd never
Oh
know.
yeah, yeah. Yeah, and I say everybody experiences it differently, so there's no way of knowing whose pain is great. Whatever, it doesn't matter.
Hmm.
Um, but that pain, because it was so insistent and it was just never ending,
Mm.
and it would be a 6 or 7 just as a standard, and then for a while it would be up. Um, but just that constant level
Yeah, and
of
I can't live every day like this kind
yeah,
of feeling.
yeah.
Yeah.
Um,
And I'm guessing the drugs don't just target that numbs everything, does it?
no, they don't. Certainly, any of the ones I took, they weren't particularly effective. Like your opiates and stuff don't work for chronic pain. I tried ones that more target nerve pain, like your pregabalin and gabapentin and all the rest of it. Um, but the side effects were something else.
Mhm.
And I say when I came off them, I didn't, didn't actually notice much difference.
Yeah.
Um,
Yeah.
so it was finding ways of managing
Yeah.
rather than actually getting rid of the pain. You had to work your way around it
Yeah.
and figure out how you can still do life. It took me a long time to accept that I needed a wheelchair.
Mhm.
And I was like, well, actually, it will let me do things that I can't do now.
Mhm.
So it's actually a sign of freedom rather than a sign of
Mhm. I think that I've said it before as well. Acceptance is probably one of the biggest words you can ever say
mhm,
of dealing with an issue and go, right, if I accept this, I understand my life will be different from now on,
yeah,
but it's accepting it at that point. So
yeah.
you go now accept that now I need a wheelchair, and that's not a bad thing. This is going to help me.
Well, that's it, and it's that kind of mindset as well, and trying because I'm stubborn. I think most
Yeah,
people are, but like,
yeah,
well, no, I don't want to admit defeat when actually
yeah,
it's not. It's that means I could go like I went to Alton Towers. I couldn't have done that without the wheelchair. Um, any length of way, even when I went shopping, I would take the wheelchair because it saves that little bit of pain and energy
mhm,
for something else that I would
mhm,
enjoy.
yeah.
Um, so yeah, it was
you see some pain management as well. So
Exactly,
if I
yeah.
don't do that, then I can
Yeah,
do the other. It's
exactly.
going to hurt for a bit, but I'll have some
Yeah,
fun. Yeah,
yeah, exactly. Like, I'll go and ride the horses or whatever.
yeah,
And yeah, it's that sort of, right, what can I do?
yeah.
But that was exhausting as well, the sort of mental load of it all and figuring out, like, I wouldn't go out with my friends or anything, and if I did, I would always drive, so I knew that I had
Hmm.
an escape.
Hmm.
Like, I could just leave if it got too bad. But going out, I'd be thinking, right, where can I sit that's out of the way that nobody will bump into me?
Hmm.
Is there a window open? Is there, and it was all of that going on. And it was exhausting.
Hmm.
Um, Whereas now, even if I'm in a wheelchair, I can go out and batter around and it doesn't matter.
Yeah, you don't think it has a knock-on effect of your social life
Yeah,
as well, and also it depends on age and your circumstances and all that kind of stuff, and it's sort of it's tough because people want to help out, but when you're out, people just want to have fun as well, and
well,
you don't
that's
want to
it.
be,
Yeah,
you're
and I
not bringing
hate.
the whole team down,
Yeah,
do you? It's one of those.
yeah.
You go, I'll not
I'll be
bother,
all
and
right.
then
Yeah,
you become a recluse, and then your life changes, and
yeah.
then you get down, and then
It's
it's
all.
a long
Mm,
stream of knock-on, roll-on effects, however you want to call it,
yeah,
and that's that's a difficult. Yeah, I understand how you get to that
yeah.
point of you don't
And
want to
I
continue
hate asking for and accepting help.
because of the stubbornness, of course.
Yeah, yeah. I really struggle
Mhm,
with just accepting that
mhm,
and actually realizing that I do. Well, now obviously as well, I need the help.
mhm.
Um, but yeah,
Acceptance again
yeah.
is
And
it's
that
getting
was probably the hardest bit. I think was actually being like, right, just admit you can't do it. Like,
yeah,
it's, and people are happy to help for the
yeah.
most part. Like my sister has done so much for me. Um, and even coming from her, and obviously she's family, not obliged to, but
Mhm.
she's very, very happy to help. But you still have that guilt, being like, "Well,
Yeah,
can I do
yeah.
something more here?" Or it's
Yeah, and then you've got the opposite side where everybody wants to do everything because they think it's your first day with an
yeah,
as an amputee. Do you know what I mean?
yeah,
It's kind of yeah. I've done it because I don't even buy until if you want, because I know people will ask if they want some help, but I'm
yeah,
not going to jump in because I know for a fact that you're just going to go, what you doing?
yeah,
This is Tuesday for me. Do
yeah,
you know what I
yeah,
mean?
basically,
It's
yeah.
kind of so yeah, but we do want to help and we go,
And
and
that's it. And I think for the most part, that
yeah,
humans in general aren't terrible.
yeah,
And if they
yeah,
see you struggling or whatever, they will. Even a
yeah,
stranger will come and
yeah.
help.
I think it's we should just be a bit more open and honest. Like a child would go, "Oh, why have you got a leg like that?" Good, because at least
Oh yeah,
because you want people to understand and know,
yeah,
and then they'll have the knowledge and carry that forward, so they won't ask again.
absolutely.
And
Yeah,
it's knowledge, isn't it? And it's
yeah, and
education.
and kids are brilliant. I think
Yeah.
they're it's just curiosity. There was a kid behind me in a queue yesterday, and she was obviously going to her mum. What's that? Like,
Yeah.
and her mum's going, quiet, I'll tell you later. And I just turned
Shush.
around and I
Yeah.
said, look, I said, she's absolutely fine. If she wants to ask questions, then let her. And she was like, all right, okay.
Yeah. Yeah.
And, they're just curious. And it's just something different, isn't
Mm-hmm.
it? She just didn't understand where I stopped and the leg started, basically,
Mm-hmm.
which is fair enough.
Mm-hmm.
Um, and I think my favourite one was a kid, I think it was in Tesco's. And they were going, Mum, I've seen that on YouTube. You get a new leg. I was like, that's amazing. And that's kind of what you want, and it's kind of, as much as I don't like talking and the focus on me sort of thing. That's kind of why I thought I would do something like this,
Mm-hmm.
because if it gets to one other person who thinks, actually, I'll give that a try,
Mm-hmm.
or say if a kid sees it and thinks that's kind of cool,
Mm-hmm.
like, fine,
I think as well, it's seeing it from a different perspective because you don't say it about yourself, say it about the issue or the
yeah,
the subject. Use it as like
exactly. It's a kind of
I have
platform.
like it's almost like I've got a special power. Do you know what
Yeah,
I mean? I've got a thing which people are intrigued in, so I'm going to talk about the thing.
yeah,
It doesn't have to be, in a
yeah,
life
exactly.
story, but I can tell you about the thing,
Yeah,
and it's what you're comfortable with as well. So, obviously, I know not everybody wants that, but I'm all about encouragement. I embarrass my kids all the time because I'll just go and ask because I do this, and I'm intrigued, and I know for a fact people will tell you, or they won't.
Well, that's it, and most people are happy to talk.
Yeah, they
Like,
will.
especially, I say, with something like this, I don't think any of my patients that I've ever spoke to have had problems with kids coming up to them and going, "What happened?"
Yeah.
You know, whereas the parents are often absolutely mortified, and you're like, "Well, actually," and I get why they would be, but then I also don't want to be turning around to kids and be like, "Well, have a chat with me," because I'm a stranger at the end of the day. Like,
Yeah.
it's a bit like, where's the
Yeah.
line here, you know?
Yeah.
Um, but yeah, it's just given,
Yeah.
like you say, a bit more education and a bit
Uh-huh.
more exposure,
Yeah.
and that actually it's all right to talk about it.
It is, and I do think it's one of those things. It's if I was a kid and I asked that, I'd remember that forever, because it's a kind of one-off
Yeah,
thing. It's a one-off. It's that's the day I learned about that,
yeah,
and I think that's the thing. That's the day I saw something, and it kind of gave me the knowledge of that, and then they'll tell their friends, and it kind of you're informing more
yeah,
people by doing that, you
exactly,
know,
exactly.
and then that carries through their lifespan, and then they can pass it on. Do
Yeah.
you know what I mean? It's sort of, and then their kids will have less of a fear, and they won't say, "Shush, don't ask." Do you know what I
Yeah,
mean?
yeah, exactly.
You got to see it in that way. You got to
Mm.
break that. You got to break that
Break the
chain at some
cycle, yeah.
point.
And I think things like the Paralympics and the the more publicity and exposure that it's had
Hmm.
has helped that hugely.
Yeah.
Um, and it is, like you say, just breaking that
Hmm.
cycle, and actually, because I particularly, I mean, my parents' generation and stuff, it's all very, "Oh, don't talk about
Don't
that.
talk about that.
Don't
Yeah.
talk about anything," like,
Yes. Yeah.
and there's a bit of a taboo about it. When
Hmm.
actually, I think this younger generation are getting more open-minded, I suppose, and more sort of
Hmm.
happy to talk and happy
Hmm.
to be a bit more curious about things, maybe.
Yeah, I know. I had this conversation the day. It kind of opens a door. You're a bit more sensitive and in tune with your own emotions as well, but you're less
Yeah,
fearful around everybody and all that kind of stuff
yeah,
because, you know, your kids talk to you as if like they're the same age as you, and you go, "Hang on, I would never
yeah,
speak like this to my parents back in the day."
yeah,
You just didn't do that. But we have I think as humans, we overcompensate for everything, but there's probably a balance that'll settle
mm.
in about 10, 20 years time, you know,
Yeah, I think
especially
so.
even with social media and things like
Yeah,
that, you know.
100%,
So
100%.
um this the decision, I mean, we've gone through all of that, the decision because of the pain. I really want to just touch on the mental aspect as well, because you kind of go, oh well, I probably have a little bit of knowledge because I've had patients who've been through this,
Yeah,
but then you're in the bed.
yeah.
It's a different story.
Oh,
Because you
100%.
do not know what feelings you will have until
No,
that happens.
no,
So, yeah, knowing what somebody feels, you don't.
no.
But
It's yeah, it was. I say I was fairly well drugged up, which was part of the process to try and control the pain, basically to make sure
mhm,
nothing terrible happened. And it was quite weird, and I had an epidural in for a couple of days after. So obviously I couldn't feel it,
mhm,
but then the epidural ran out. It was odd. It was working down this leg and not that leg, um, and I remember maybe it was 1 or 2 days because I was in hospital for about a week, um, and somebody came and sat on the bed where my leg should have been, and oh no, wait, it's not there. It's fine. And then so that after the surgery, the phantoms, my leg was going down through the bed, which was really weird.
right.
Um,
So you can still feel it.
yeah, it was
Or
like pins and needles. Um,
okay,
but yeah, see that was it was going down through the bed, and that kind of messed with my head a little bit. 'Cause I
yeah.
thought, "Oh, that's bizarre."
What's the reason for that as well? Because is that nerve and
Yeah, so obviously the nerves are just being cut,
mhm,
and they'll keep growing.
mhm,
Um, but yeah, I mean the phantoms again are not something we understand particularly. Some people get them early on, some people never get them, some people get them 10 years down the line.
mhm,
Um, Mine have kind of varied. Uh, Thankfully, it's not, touch wood, been particularly painful.
mhm.
When I had that infection last week, that was incredibly bad. I had really bad phantoms, and that's when I knew something was wrong. So I was like,
Okay,
there was something knocking about in there that isn't happy.
right.
Um, But yeah, I think it's quite common, the going through the bed from the patients I've spoken to. It was just bizarre.
Yeah.
And first, I think the first proper memory in hospital, I went to take my slipper off, and obviously the foot's not there.
Yeah. Yeah,
So it's
using the
just
other leg as a functionality.
yeah,
Yeah.
just daft things like that. And I say I went to take my slipper off, and I was like, you can't do that because there's no foot. Um,
Must take a while to get used to, because
yeah.
you've lived so. I mean, at what age had you lived with the leg before
So
that?
I was 38.
All right,
Yeah.
okay. So it's every
Um,
single day of your
yeah.
life of just yeah.
And then it's rewiring your brain. I think the 5 years or whatever running up to it, I had been so aware of that leg because of the pain.
Mhm.
Because a lot of patients forget that they don't have a leg, and they'll fall over or they'll fall out of bed or they'll get up in the middle of the night to go for a wee and go to walk. I've not, again, touch wood, I've not had that problem. I think, again, because I was so aware of that leg that my brain's kind of wired to remember that there's a problem,
Mhm.
sort of thing.
Yeah.
Um, so yeah, it is a bizarre feeling, and getting, yeah, like you say, your whole life with a leg, and then, I mean, sometimes I still go to look down and go, "Wait, cut my leg off." Like,
Yeah.
it's really odd to say.
Yeah.
Sometimes it's just one of them, like, oh, I
Mhm.
don't, it's yeah, your brain's a funny
Mhm.
creature. Um,
But the position you are now compared to what you were when you had the leg, is there a comparison? Like,
oh, no.
no.
um, I mean, I was hugely overweight. I mean, I'm not the smallest person, but I was hugely overweight because food was the only kind of comfort, I suppose.
Mhm.
Um, I couldn't. I could walk to the car just about. Used a stick or a wheelchair all the time, and just to say, getting by every day
Yeah.
was was a challenge in itself. As now, life is difficult in a different way.
Yeah.
Like there's always going to be challenges, and I knew that going in. But my good days are a hell of a lot better than I couldn't even say I had particularly good days, you know.
Mhm.
Um,
Were
so
you particularly active before that, before you started getting issues, or did you want to be?
um, I'm I was reasonably active with the horses and stuff,
Mhm.
but not. I wasn't. Well, ran a few 10Ks,
I mean, it's a few
but
more than me. So,
um, but I wasn't like one of these. I say I'd never been to a gym. I would go for a run because I didn't mind it. Quite enjoyed it. It was quite therapeutic, I think. Um, I played hockey when I was younger
mhm.
until I bust my knee.
Mhm.
um, but no, I wasn't. I wouldn't say I was like a definitely not like a gym bunny
Mhm.
or
Yeah.
none of that. It
But
was.
I mean, I suppose riding horses is quite a
It
physical
is, well,
feat as
looking
well.
after them,
Yeah,
yeah,
yeah.
is quite a physical,
Mhm.
reasonably physical job, and it takes a lot of time as well. So as much as anything, I didn't particularly have the time
Mhm.
to do a lot else, and
Mhm.
particularly with the no energy.
Yeah.
um, so I say now, like, I could go to work, I can go and see the horses, and then I can go to the gym, and that's okay.
Mhm.
Whereas before, I couldn't even have comprehended that.
Mhm.
Um,
And kind of finding the gym. I know we mentioned before, but how did you start out? What was the thing that go right? Right, let's try this. I know you want to be more functional, but walking into a gym, it's quite a tough ask as well, isn't it?
Yeah, and I think finding that gym,
Hmm.
it's a little independent gym. It's not a big, glass windows and 20 treadmills or whatever. Um, and Shauna just was dead encouraging and understanding, and like, I think to start with, she would be a bit like, "Well, can you do this?" And sort of,
Hmm.
because she's never trained an
Yeah,
amputee.
so it's figuring it out, isn't it? What you're
Yeah,
comfortable with.
and
Yeah.
I can say I'll give it a try. Like, worst that happens is I fall on my face. I'm not too bothered about that. I'll get back up. Whereas now she's just like, right, on you go.
Hmm.
Like, and I think, yeah, say that encouragement and that support actually just meant I kept going back.
Hmm.
Um, and when I started, I was going to I go to physio. So physio was in Manchester. Go to physio one week, and then go to the gym the next week and have like a PT session. And it was just little like dumbbell deadlifts and off boxes to start with because I couldn't get to the floor. Um, and I didn't know, I say, what my limits were and what I could do. So it was kind of building on that and figuring out what my strengths were,
Mhm.
figuratively and literally, and what I could manage and there's things that I can't do, and if I can't work around it, then I'll try something else, and that's fine. But I'll go to the classes and do the same as everybody else. I'll be blowing out my arse, but I'll do it. And I say it was really quite a slow thing, to be fair. It was like, I say, once every fortnight or whatever, and then I think went a little bit more regularly, and it was getting that. Oh, actually, I can do a bit more, and I feel okay after I've been like, I'm not having to go to bed for 3 days. And then it might have been maybe the start of last year. Shauna was like, "Well, there's a competition in November." All right. um, and yeah, just I started training for that, and then yeah, it just I'm not too bad at it, I suppose. I mean, there's nothing
Okay.
really to compare it to, but
Yeah.
um, but yeah, it's the people you meet as well, I think, and
Mhm.
the community and people like Gemma, who's mad as a box of frogs and just a brilliant, brilliant human being.
Oh, she's great.
Um,
Yeah.
and just so encouraging, and like when you're feeling a bit down on yourself, because I'm terrible for, I'm not good enough, and what am I doing this for, and I should be
Mhm.
lifting that or whatever, and just, no, shut up, you're fine, like
Yeah.
you're actually doing all right, sort of thing. Um, and I think I get the mental side of it as well. Um,
Mhm. So it's helped you massively.
yeah,
Yeah.
hugely.
Even going from like pretty much inactive, but because you couldn't do anything and you're in pain, to the position that you're at now, doing things that you'd never done before.
Yeah.
It's kind of, have you surprised yourself?
Oh, 100%. I say when Shauna said, "Oh, into this," it was the World Deadlifting Council competition up in Glasgow. She's like, "Why don't you go in that? There's no records for an adaptive female." And I was like, "Oh well, I can set some." Um, but even then, I was a bit like, "What? Am I am I good enough to be even setting foot on this stage?" Sort of thing.
Mhm.
And but actually, yeah, like it is. I did surprise myself massively,
Mhm.
and I think I still do. Like I'm going to Phoenix in September to compete at the World Championships, and that's just boggled my brain.
Mhm.
Like, and then but even then, like that's amazing. But I'm like, well, I'm kind of cheating because I was the only one in my category. Like, but then I thought I wasn't going to go because obviously it's a lot of money and a lot of time. I thought if one other person sees and thinks I'll give that a try, that's enough for me.
I think
Um,
you'd be amazed. I think you doing it will just go, oh, I want to do that.
I hope so.
I think I can do that. Because that's how it starts.
Well, that's it, and
And I think that's a good
yeah,
thing about you doing it.
yeah,
And I know yourself. You go, the competitive in a thought to be like, oh, I don't want to get beat. All this kind of. Do you know what I mean? There's a competitive nature, and you're stubborn, so it's probably there anyway. Do you know what I mean? So
yeah,
I guarantee it's there. But it's thinking on a different level
yeah.
of, imagine if you've kickstarted something.
I hope so. And I was competing in Glasgow in March, and I was chatting to a guy who competes as below the knee amputee, and he coaches an above knee, um, who came to watch. And after seeing me, because he'd been training seated, he was like, "I want to do it standing." I was like, "Do you know what? That's a really nice feeling," because he'd seen me do it.
Mhm.
It's like, "Can we try that?"
Yeah,
And yeah, but don't tell your prosthetist.
yeah.
um, but yeah, I say that was quite rewarding. Like
Mhm,
somebody else going,
mhm.
because you're doing it, I'm going to give it a bash.
Is
Um,
is there anyone in the industry? I know all of this industry. It's really hard to get funding and all that kind of stuff, and it's an expensive game and a strong world and all that kind of thing. But is there anybody that works with prosthetics in the strength world? Could there be
no.
a unique one that you could work with, and then you could create one? It's sort
Well,
of
this is it. I think that because so the weight limit on that is 136 kilos, which obviously isn't a lot plus me. Um, so there's no good. I mean, there's not very many amputees that try and lift heavy things. And like the disabled strongman make you compete seated.
Mhm.
Because I was looked into that, but I don't like training seated, so I didn't do it.
Mhm.
Um, but because the prosthetics don't have the, the weight limits on them, and I don't know if there's anything that can be done about that, but there's nothing really on the market. I
Mhm.
mean, there might be some in America because obviously they've got
Yeah.
um,
Resources.
larger people as
Mhm.
well. As much as anything,
Yeah.
and the weight limits can go up for that.
Mhm.
But usually, when your weight limit goes up, the functionality goes down. Not
Mhm.
always.
Mhm.
Um, but yeah, it'd be interesting to see if somebody would want to,
Mhm.
and with a bit more publicity and a bit more exposure, then maybe one of the companies or that might think, oh, yeah, we'll have a look at that.
Mhm.
But I don't
Yeah.
know.
Well, one last thing. Casey's just sort of a message to somebody out there who's maybe gone through similar things to you, or what would you like to say from your journey to somebody?
Don't give up, I suppose. Because I say, if I had and I didn't have the support system that I have, I think I wouldn't be here. So if you're in that position, I guess try and find somebody. Doesn't matter if it's somebody online that you can talk to, or somebody in your family, or a total stranger. That support system, I think, is really important, and having somebody that will fight your corner. Because I was out to fight, and my sister fought it for me. And I think, yeah, that's yeah, just I say try and find some sort of outlet that can help, and finding the right medical professionals that can help you is difficult as well, and you do get appointment fatigue, and you just I say I couldn't be bothered anymore. Um, and had I not had my sister going, right, we're going to go and look into this and see this person, and this person does that, and so yeah, say it's finding somebody or something that you can reach out to, and then yeah, if you can find a gym or a book club or whatever, it doesn't really matter. That there's people that will help and make you feel better when you're feeling shitty about yourself. Yeah, say it doesn't matter what it is. I went to a cake decorating class for a while, and the ladies there were brilliant. And I say it's trying to hold on to something basically, and trying to hold on to the little moments of joy, even though it's difficult to see them sometimes. Um, and I think, yeah, but I say before I had my leg amputated, I was struggling to find those little moments of joy, but they are there, and yeah, I suppose just keep fighting for it, even though when you feel like you run out of fight, which I get, um, is is just I say finding something that works for you, and I certainly wouldn't recommend. I'll just put a caveat in there: amputation is not for everybody. It's not a magic answer. It's not a cure. And yeah, it's worked for me, and I'm very happy with my life now. But I wouldn't ever, try and rose tinted glasses. I can't think of the word. I wouldn't ever try and say to somebody that's going to be your magic answer, because it isn't. It's a hard life, um, and it doesn't necessarily solve the problem. Um, but it's I say finding the right answer for you as difficult as it is sometimes, um, as to what is the right outcome, I suppose, and what's. But yeah, I wouldn't ever glorify. That's the word I was looking for. Having an amputation, because I think that can be really problematic. Because you see it all the time, and people they have like body dysmorphias and all sorts. Um, so I certainly wouldn't ever say, "Oh yeah, this is brilliant." It isn't. Um,
Yeah.
but it's
Yeah.
it's
I think once again, everyone's different, and
exactly,
one
yeah.
size doesn't fit all
No,
either
no,
for
100%.
anything in life.
Yeah,
Yeah.
exactly. and that's it. And yeah, everybody is different. So, but no, and amputees, give it a try. You know, if you fancy doing something daft, like I thought it was a bit mad, then you might surprise yourself.
Brilliant. Thanks a lot.
Thank you.
Excellent.